Okay, good afternoon. Thanks for joining us. I'm Kristen Scovira, and as you might have noticed, it is springtime. And as of course we embark on spring, we also have to deal with some of those symptoms, right? The itchy eyes and maybe the runny nose, sore throat. Right now, it may be a little bit of a question, right? Is that allergies or maybe something a little bit more serious, right? So we're here to answer those questions. We have some local health experts standing by here. We've got from Regents Blue Shield, Dr. Amy Kahn. Thanks, Amy, for joining us. Hi.
Hi, good to
And
be
then we
here,
have,
Kristen.
yeah, you're welcome. And Dr. Neetu Telreja, and she's with the Allergy Group. Hello,
Hi, thank you
doctor.
for having me over. Thank
Yeah.
you. Yeah.
Um, so first of all, yeah, thanks so much for joining us. This is something that, we've been talking amongst ourselves about that, now we have some of those symptoms and you wake up and you have a sore throat. It's just kind of a anxious feeling, right? Because now you wonder if it's gonna go away with a quick allergy pill or if you should go see your doctor. So first of all, what are the biggest symptom differences that you're gonna see between COVID-19 and just the common springtime allergy?
Yeah, great question. And we've been dealing it for the last 1 year. So I think we should have become experts by now, but we haven't. There are tons of questions out there and evolving. Please say that when it comes to allergies, we always think about runny, itchy nose, exactly what you said, itchy, swollen eyes, associated with nasal congestion and sometimes sore throat. Um, COVID-19 is a viral respiratory illness, as you all know, caused by SARS-CoV-2, which can cause symptoms as simple as mild common cold to acute respiratory distress syndrome. So some of the symptoms that match or not match would be fever, shortness of breath, sore throat, nasal congestion, and muscle fatigue, headaches that are mostly specific to COVID-19 than to allergies. But I would say one thing, that if you have loss of sense of smell and taste, it could be a sole symptom to just go get tested for COVID-19. I would say that fever is not a symptom of allergies. And if you have a pattern that every year during this time of the year, you have had these same runny, itchy nose, swollen eyes, you know it is allergies because it's the same time of the year. So I think there are several triggers at the end. Seeking medical care, talking to either a board certified allergist or your internist or your family practice doctor is the best way to go to confirm. And you can do those through telemedicine visit.
So that, yeah, that might be a good option. Have you experienced these questions so far this season? Have people been coming to you saying that they're a little confused?
I mean, all year, totally. Like since last year, March, when the whole process started, we came to know more about coronavirus. Uh, our patients were so thankful to just have a telemedicine visit where they could talk to us and differentiate whether this is allergies or COVID-19. And I think that was the most rewarding thing that we did during that time, helping our patients with mild seasonal symptoms or common cold symptoms to be able to not have them panic whether this is COVID-19 or not. And yes, we did recommend a lot of testing, but I think we still were able to help them, and telemedicine visits did help. So yes, a ton of questions in the last 1 year.
Yeah, definitely want to give them that reassurance. Anything you would like to add there, Dr. Khan, in terms of maybe people just saying, hey, can you help me out, differentiate these symptoms? Has that been something, especially with all the flowering trees around Boise and the surrounding areas here?
Right. So, absolutely, spring has sprung in Boise. We're all dealing with the pollen in the air. And I think it's important to keep in mind on those particularly windy days, if you're susceptible to seasonal allergies, we call that hay fever. Sort of that itchy eyes, itchy nose, maybe scratchy throat and itchy ears, even, really keep in mind that, stay indoors is really helpful because if this happens every season for you, it's probably hitting about now. One other thing I wanted to offer is that duration is important. People who have COVID are sick for less than 2 weeks on average, unless you have a very severe course. It is, typically 10, 12 days max. And so we know with seasonal allergies, it can come on and then last for weeks or even a couple months, really, depending on what you may be reacting or responding to. The other thing I think is just keeping in mind that if you have COVID, you might have the history of being exposed to another infected person. If you've been immunized, you've gotten the vaccine against COVID, it's pretty unlikely that you would be developing acute COVID. Of course, you want to make sure that, you see if you have a fever, joint aches, that tends to be a little more common, muscle aches with the COVID. Even GI symptoms are common in COVID. We don't see that as much in allergy symptoms. So about a third of people will have a little nausea, maybe diarrhea, a little stomach upset, when they're acutely affected with COVID. So that's sort of another thing to keep in mind, in addition to the other distinctions that the other doctor has mentioned.
Yeah, thanks so much. Yeah, I have noticed, it is windy today. It was super windy yesterday, and just all of that in the air. I woke up with a sore throat, but it dissipated, thank goodness. All right, so what kind of health conditions could someone have that might be, of concern or might warrant more concern right now? And we can toss that question out there too.
Well, let me start, and then Doctor, if you would follow up. I think the main thing to keep in mind as we think about seasonal allergies and this backdrop of COVID-19 and the pandemic, people who have chronic illness such as heart disease, lung disease, diabetes, obesity, these are individuals who may be at higher risk for more serious COVID infection. It's really important to stay on top of those conditions. If you've missed or skipped appointments with your doctor, make sure you get in, make sure you're taking your medications. Really keep in mind that those represent higher risk factors if you were for more severe COVID. We do want to mention something about asthma. There are some people who have seasonal allergies, but also have a history of asthma. Those individuals also may be a little greater risk than to have more symptoms of wheezing or shortness of breath or cough, and certainly something to be on top of in terms of taking the medications as prescribed. Those may include a regular type of medication, maybe dosing with inhalers with some rescue medication as well. But for persons who've not yet been immunized against COVID-19, if you are asthmatic, something to think about, particularly because you don't want to have to be dealing with maybe a seasonal component to also on top of being infected with COVID.
Yeah. You want to take that question into over there,
Sure.
and then we're going to answer a question here too that someone has posed, but I want you to field that as well.
Great answer, Dr. Khan, and I'm glad that you're here to add on the internal medicine, diabetes, obesity, risk factors that are associated with COVID-19. In terms of where, as a board-certified allergist, I stand, it would be that asthma, yes, moderate to severe asthma, patients should take care of themselves, keep their asthma controlled with taking care of their inhaled steroids every day, control their medication every day, and use rescue inhaler as needed. Because yes, when COVID-19 would affect your lower respiratory tract, it could present totally with wheezing and lower respiratory symptoms with cough that we normally see in asthma patients. I would say that the hospitalized patients that was studied didn't had an underrepresentation of asthma, and I think probably because these patients were very well controlled. But non-hospitalized patients, we do not know how much asthma was playing a role. So therefore, at this time, with the evolving knowledge, asthma control is very well important, and getting vaccinated for asthma patients, as Dr. Khan said, is really important. I also just want to add, in terms of other allergy conditions that I see, that atopic dermatitis, allergic rhinitis, the inflammation associated with these conditions is not going to put you at a risk of having severe inflammation if you get COVID-19. Yes, you should take care of your skin and your other allergic conditions and take your medications. But that allergic inflammation, as you call it, is not related to the cytokine storm that people are talking about COVID-19.
Okay, thank you, Dr. Calreja there. And now we have a kind of a comment here, but I thought it was interesting. Kelsey's saying postnasal drip can cause some GI issues, right? So sometimes all of that eventually does get your insides a little upset. So maybe that was something that would be concerning if someone had that for days on end, right, Dr. Khan? Or
Right. So postnasal drip can also be a cause of even chronic cough as well. So yes, if that's due to maybe allergic response, certainly making sure you're managing those symptoms. And for some individuals, some nasal steroids or inhalers can really be helpful with those symptoms as well.
Okay, so now let's move towards some solutions right here. How can we limit exposure to both allergens and COVID-19?
I think it's a great question, limiting to allergens and COVID-19. Some things play hand in hand. I think physical distancing for not getting an infection, wearing a mask, sanitizing and washing your hands for 20 seconds, staying sick when you're staying home when you're sick, I think all help you with infection. But also, I think people have always practiced these measures during especially windy days like today, where they stay home and do not do exercise outside or do anything that exposes them to pollen more. I think one of the things, just simple wearing sunglasses to not have your eyes exposed to the pollen outside, taking your medications compliantly, which Dr. Khan mentioned about inhaled steroids and nasal sprays, making sure that you take a shower every night so you don't take pollen to your bed, keeping your windows shut. I think these simple, common things would be helping you from allergens, and also all the things that we have taken as precautions in the last year for COVID-19.
Yeah. Directing more to you, Dr. Khan, about just COVID-19 in general. What are the precautions that you keep telling folks, especially as now, maybe some of those restrictions get lifted and people get a little lackadaisical?
Right. So some of this is just common sense. And if you're someone who has not been immunized against COVID, perhaps have not been naturally infected, you're still at risk. We do still have this virus, circulating in our community, and so it does make sense to wear a mask if you're going out and going to be close with other people, if you're in closed areas, making sure that, choose to be outdoors as opposed to indoors when you have that option. And of course, you're making sure that, you consider at least getting the immunization if it's offered to you. And it's all offered to all Idahoans age 16 and older. In addition to that, I just wanted to kind of say, in terms of best time of day to get outside, if you tend to be somebody who reacts to that pollen, you probably don't want to be out in the morning. Later in the day might be better. Better to be out just after it rains. If we get rain, to be out, this probably tamps down the pollen. It's not, in the air quite as much. Just sort of thinking about that. And then, of course, indoor air quality, such an important piece. We know that's true for both seasonal allergies. We know that's true for COVID and other respiratory infections. You really want to recognize that, closed spaces where there's not a lot of fresh air circulating through there can be problematic. Think about a HEPA filter if you're particularly sensitive. Maybe looking at your air filter on your furnace. One of the things I've been really impressed with is there have been documentation sometimes indoor air quality can be 3 to 4 times worse than outdoor air quality. So making sure you've checked that filter in your furnace, change it. There are certain grades of filter that you can get. Launder your clothes in addition to maybe leaving them at the door when you come in from, say, outside after you've worked in the yard or been out at a park or something. Laundering those and changing your bed linens. You don't want to, as the doctor said, bring it to bed, these pollens, to bed with you, right? So you really want to think about your home. If you are allergic to other things in your house, certainly thinking about hard surfaces versus carpeting, keeping the carpets clean, of course, and again, wearing a mask if you know you're going to be in a situation where there's pollens or dust, or again, if you're circulating out with people who may be potentially infectious with COVID.
Thank you. So when it comes to the treatment itself, when do you get to the point where you say, that's it, I have to see a doctor? At what point do you think that that's the moment where you stop doing the home remedies and you've tried all the things, you've changed the linens and nothing's working? Is that when you seek professional help and take it to the next level? I
would say so. I think when it starts affecting your quality of life, you you can see a professional try over-the-counter antihistamines. I think there are several options right now, oral and intranasal. You could try that, but I really think for the right direction and for figuring out what you're allergic to, as Dr. Khan said, it could be your indoor allergens like your pet dander, dust mites, mold, your air quality inside, how to help you with those. And of course, the pollen that's outside with the trees and the grasses and the weeds that bloom at different times of the year, to just have that kind of a expert opinion in helping your allergies better. Once you have tried these home remedies and also some of the over-the-counter medications, but once it starts affecting your sleep, your quality of life, causes you to have fatigue, not have you focus, I would say from my experience in the last year, people who are working from home, they have been indoors, they're more exposed to the pet dander. They have this chronic nasal congestion and sinus headaches that they are fighting through. They had never had it before so much that they have had it in the last 1 year. And when you come to think of it, they were like, why has this change happened? And I think we figured out that most of it is because now they're more exposed to their pet dander and the air quality that's inside their house. So I think, as Dr. Khan said, that, changing the air filter, if all that doesn't help, I think knowing what's right to do is to see an expert opinion and seek help timely.
Yeah, that's very interesting about how your environment, just the sheer amount of time you're spending there could trigger something that in another year you might have not has been as affected by, even like a pet or something that you don't see as much, or you're not around those same irritants necessarily. We have a question that came through. This is from Lou, and he's saying, are some types of masks better than others at stopping pollen? Maybe Dr. Khan, if you want to pick that one up.
Sure. I think I would just mention that, the tighter the weave of the mask, the better the filtration. And of course, we also like to think about fit as well. But you really want to block the larger pieces of pollen from, getting into your nasal passages or breathing those into your lungs. And so I think in a way, it's similar to what we've recommended around protection against rare illnesses like COVID or influenza for that matter. We know that fit and filtration in terms of a mask makes a difference. 2 layers of material, for example. Dr. Telrea may have some better examples about what might be ideal for the pollen. I do know that even goggles can help, so you're not getting the pollen into your eyes, if you will. And again, and just being really just about whether or not wind is a factor in terms of blowing that pollen sort of into your sinuses and into your respiratory system.
The only thing I would add is that masks hasn't been in our culture a year before. So what our knowledge we have is in the last year. But I would say that they have really helped patients in any form to help them, of course, preventing them from COVID-19, but also, exposing them directly to other kinds of viruses like flu, common cold. The number of infections of seasonal flu that we have seen this year has come down drastically. So I think mask in general, of course, with tight weave, surgical or medical or cloth masks, I think at least 3-layered mask is what they studied recently in Europe, and they said that they're working better. There have been all kinds of studies coming up regarding masks and COVID-19, but I think a proper mask, preferably 3-layered, tighter weave, as Dr. Khan said, would prevent you with all kinds of these viral infections, including COVID-19. Pollen is a new thing with mask. We haven't had it before, but of course, the decreased exposure to the nasal passages is definitely helping people from pollen and reacting.
That's funny. That was just the next question I was going to pose, was that idea of, okay, so we're talking about COVID and we're talking about allergies, but, cold and flu, also kind of can get people a little worried about COVID. So that was the direction I was going to move. So yeah, Dr. Khan, maybe you want to pick up on that. Just some of the differences between, say, flu and common cold versus COVID, if someone is experiencing some of those symptoms.
Right. So these are all respiratory viral infections that we know are spread or transmitted similarly. And it is remarkable to me, having followed the seasonal influenza disease, how few cases of influenza we've seen in the past year, in part because of the precautionary measures, right? Not just the masking and the physical distancing, but the hand washing as well. And we know that the rates, in addition to flu cases being down, the rates of just common cold are down. Those are typically due to a different type of coronavirus, could be due to an adenovirus or to a rhinovirus. And so overall, we're just seeing, fewer of those as a benefit, if you will, from some of these other precautions that we've taken, particularly to protect against a more severe potential illness from the coronavirus or novel coronavirus that causes COVID-19. Now, one other thing I did want to reference, though, is that there are a few things that folks should consider that would be additional measures to take to protect yourself. And that is, if you're a tobacco user, if you're a smoker or vapor, that you stop using those products, right? Stopping smoking is a great time to think about that, because smoking puts you at greater risk, causes more inflammation of the late nasal and respiratory passages, may put you at more risk for more severe illness. So something to consider. And the other, Dr. Telrea mentioned some of these over-the-counter agents that people may try to help manage some of the symptoms. Could be from the common cold. Maybe it's a decongestant with an antihistamine, or just the antihistamine to deal with the allergy symptoms. Be cautious that some of the side effects of those medications could cause some drowsiness, right? Could cause a little sleepiness. And so, being thoughtful about not operating, technical machinery or driving, making sure not to mix those with alcohol, for example. These are sort of some of the other precautions to be aware of as we think about measures to protect ourselves, not just from the respiratory viruses, but also how we manage seasonal allergies.
Oh, absolutely. Anyone who's taken a Benadryl and then tried to do anything after that, they've learned their lesson, right? It's just immediate drowsiness. So I want to stay away from that if we're going to be out and about. And so now talking a little bit about allergies and the vaccines, maybe I'll direct this over to you, Dr. Telrea, but what can you say about that? I mean, have people had some of those, an allergic reaction to the vaccine itself? I'll just let you weigh in on that.
Vaccines overall are safe, and COVID-19 has been particularly safe. The rate of anaphylaxis, like a life-threatening reaction to COVID vaccine, has been particularly same as other vaccines. However, the data is, of course, evolving. I do know, I was looking at the statistics this yesterday, and I saw that if there have been 5 million doses that have been, 22 million doses that have been given, and anaphylaxis have been rare. In fact, only 5 happened with the Pfizer vaccine, and 2.5 cases per million dose for Moderna vaccine. So, and Johnson & Johnson, as you know, the data is just coming up. So in terms of anaphylaxis, in terms of a life-threatening reaction, it has been very, very low. All of these patients have recovered. It happened within 15 minutes of giving the vaccine. So therefore, vaccines are safe, is again, I would say, and as Dr. Khan reiterated, that if you have not been immunized, you should go get the vaccine, and it's safe. I would also say that even if you have a risk factor of having a food allergy or a venom allergy or a latex allergy or environmental allergy or a drug allergy, you should be fine to get the vaccination. There's some literature about polyethylene glycol playing a role. However, it hasn't been proven that it is the component that's causing it. I would say that the risks versus the benefits should be measured, and we have seen several cases. We have deciphered it for so many of our patients, and I would be very proud to say that none of these patients had a reaction. We told them it's safe for you. They got it in a facility where they have allergy response treatment. None of them received any epinephrine. They were all fine, although they stayed there for 30 minutes. They all called me, so thankful. We got so many thank you emails for these kind of patients. I would just say that if you are concerned about having any reaction in your history to an injectable drug, seek care, talk to your allergist, talk to your primary care physician, internal medicine doctor to figure out exactly the history, know the risks versus benefit associated with it. I did see a couple cases where the first dose caused a reaction, and the concern was whether we should get the second dose or not. And that's, again, it's a lot of history taking, individualizing the plan, and then going for the vaccine or not. But I would say that vaccines generally are safe. When I talk about having an allergic reaction, I would talk to the patients really about having hives, difficulty breathing, some kind of throat swelling, throat constriction that they feel within 15 minutes to 30 minutes of getting the vaccine. So we ask you to stay there for 30 minutes in a medical facility for 30 minutes after the vaccine. So make sure you're observed. But reports of hypersensitivity are very rare. We haven't so far tested to a vaccine in our clinic, just because we didn't want to waste the vaccine when it's really needed for a patient or individual. But I'm sure we would offer it sometime in future when most of the people are vaccinated and we are not waiting for vaccines anymore.
Yeah, thanks for that. But it's interesting that you say that 15 minutes or 30 minutes. So it's not something that days later you're going to have this reaction. You would know pretty soon whether or not your body was having a little bit of a reaction to it. That's good for people to know.
Thanks, Kristen, for pointing that out. I think I missed that portion of a delayed reaction that we would worry about. Of course, the immediate reaction, the anaphylaxis, the life-threatening reaction is all we really care, because we don't want to, lose a precious life, and we want to really want to address it within 30 minutes so we can manage it. Usually intramuscular epinephrine is the first line treatment for a severe allergic reaction. But you're right, coming to delayed reactions, yes. I mean, we have seen so many patients talking to us, and of course we are biased because we are in an allergy clinic, and we see more of a population who would have concerns with vaccines. But yeah, delayed reaction. Some people have had a large local reaction at the place where they had the vaccine. But that is common with other injections and injection site reactions as well. That should not tell them not to get the vaccine, second dose, and some joint aches, body aches. I bet Dr. Khan would probably want to add on those because, overall as a public health expert, she looks at the data. But yeah, delayed reactions are not life-threatening. So therefore, I would say that patient should definitely discuss whether this is because of the vaccine or not.
Thank you, Doctor. And yeah, let's turn it over to Dr. Khan now and get her take on some of what you were mentioning. There's some irritation sometimes at that injection site, and people do notice that, or very sore arm, etc.
That's right. So typically in these 2-dose vaccines, these are the messenger RNA. You may have heard them called Pfizer or Moderna. They're two variations of the same vaccine technology. Keep in mind that those who receive the first shot are more likely to have some of these local side effects, maybe a little malaise within the first few days. If you're younger, older people tend not to as much. If you've been previously naturally infected, that first dose might actually pack a little bit more of a punch than if you hadn't been previously immunized. So you might have more of those side effects that last, local, maybe malaise, so soreness, joint aches, if you will, that sore arm goes away. We know that it's important for people to get the second dose of the vaccine either 3 weeks after the Pfizer or 4 weeks after the Moderna, in part because that really serves as a booster dose to that initial vaccine, so you can stimulate a more robust immune response. And people are considered fully immunized within 2 weeks after that second shot. So that would be the time it would take for our bodies to fully develop the antibody response, which are going to allow for that protection. And so what we've seen in Idaho is about a third of the population has received, let's say, first dose of the vaccine. I believe about 23-24% of Idahoans have been fully immunized right now. But now the vaccine is more widely available. It's certainly open to age groups age 16 and older now. And for some of the harder to reach communities, I know there are a number of initiatives going on to think about mobile vaccine clinics, going to some of the community centers, again, reaching reaching out to folks that perhaps have not yet had access, maybe didn't have a smartphone, they couldn't sign up online, really making sure that those who are eligible for vaccine can get it. Watching ever so closely to reach that herd immunity, keeping in mind that probably 25% or so of Idahoans may have been naturally infected. If you add on another, say, 25% who are protected through vaccine, maybe that's half of the population or more eventually being more protected. And what that does, which is so important, is to stop the person-to-person transmission. The likelihood that person who's infected could spread to another susceptible person goes down significantly when more of the population is protected. So that's kind of exciting. And I'd be remiss not to mention that, this is now a condition, COVID-19, in which we have, a vaccine preventable approach on top of these other safety measures. But there's other conditions that we use vaccines for. So if you're due for, your pertussis tetanus booster as a preteen, or a woman who's pregnant who needs a Tdap because she wants to protect against getting pertussis, or influenza, right? We're kind of getting towards the end of the seasonal influenza, but remember, influenza, it's important to get typically in the latter part of the year, even as early as January, February, on a seasonal basis, right? So there are several other vaccine-preventable diseases in which we have periodic immunizations available.
That's a lot of good information. Thank you, Doctor. Anything else you would like to add over there, Dr. Talreja, or you feel like we had it covered on that?
I think I would just say annual flu shots are important, and I would just say that Idahoans have done a great job this year. We offer flu vaccine in our clinic, and this is the fastest year that we got all of it covered. Whatever we had ordered it was amazing how people took care of them. So kudos to the population right now is taking care of themselves out there. Good job.
Good job. Anything else you want to mention that we forgot to touch on about the connection there between, those allergy symptoms and what we would be worried about? Or, I think you guys have given so many wonderful answers here and a lot of good information. People have weighed in as well.
I think I would just offer that, it's always important to get back to basics, right? It's been quite a year we've all lived through, so get back to, following a healthy diet, maybe losing some of the COVID-19 pounds that some of us gained because we were indoors and not exercising. So, get back to those health habits that are so important, because that all improves our immune response and the likelihood that we wouldn't become ill with anything else. Follow up on those chronic conditions and be sure to attend to some of those recommended preventive measures, right? It's going to be beautiful in the coming weeks and months. We know everybody's anxious to get outside and start, engaging in more fully in our lives, but just use common sense, right? Some of the things I hope we shared with you today are some things that you can put to good use, and we know that we've got a bright new heading in front of us.
Thank you so much, Dr. Khan. And then, anything else, Dr. Talreja, there that you'd like to add?
Thank you so much for this beautiful conversation and learning from each other. I think it was very informative. I would just add, take care of yourself. Whether you're inside the house mentally, isolated, reach out, go outdoors, enjoy. If you have difficulty breathing, because of the outdoor pollen allergen or any concerns with allergies, seek help. We could help. You could breathe better, and of course use the common sense and basics that Dr. Khan mentioned to take care of your health. Your health is important, and having a good, healthy, taking care of your chronic conditions would help you fight COVID-19 better. If you do get exposed, and of course get vaccinated. I think that's the way to normal.
Yeah, if there's like anything we could all take away from all this experience, it's that our health matters so much. And then, having that robust immune system, just helping your body out and getting the sleep and staying hydrated and doing all the things that we can do just in general over any year. But this, of course, completely highlighted this year. But and also the idea of getting outside. I do think that here in Idaho, we're so blessed that we can go outside. We've got so much to explore out there. So if we can get the allergies in check and get outside and enjoy the fact that it's naturally socially distanced, so we don't have to worry so much. Well, thank you so much, Doctor and Doctor. And we will leave this here, but thank you so much for your time and for answering all of our questions. If there's any other questions that we have and people tune in later and they want to get more information, where can we direct them? We'll start with you, Dr. Khan. Where should I tell them to go?
Right. There's a number of good resources available to you. Certainly, the CDC regularly puts out information and updates on their website related to COVID-19, other vaccine preventable illnesses, and also has recommendations around sufferers and what they can do to protect themselves. As well, you may check out some of the other medical for consumer, if you will, resources, whether that be, WebMD, the National Institutes of Allergy, a number of the other websites that are more consumer facing can offer some updated information. And then lastly, I'd be remiss not to mention, just Google what the pollen count is wherever you are, just to prepare. Always prepare before you're going outside, particularly if that's something that might put you at risk.
I know in the morning show at Idaho News 6, we try to do the pollen count. We try to do the allergy reports there for that very reason. And man, some of them were off the charts recently. So yeah, it was a good warning to myself or anyone who likes to go outside for those hikes. But same question to you, Dr. Talreja, like where's a good place for them to seek out help from the allergy group?
Yeah, so as Dr. Khan mentioned, the pollen count, we do a certified pollen count. We are a certified pollen counter for Idaho. So our website at the allergy group, you can check pollen count, the latest pollen count, and then plan your day accordingly. I would also say that our American Academy of Allergy and Immunology, they put out updates on COVID-19 and allergies, and newsletters are there in our in American College of Allergy and Asthma and Immunology. So these websites are amazing resources for allergies and asthma.
Awesome. Hey, thank you so much. And we'll let you get back to whatever it was you were doing before you stopped and did this for us. But we really appreciate the time that you took. And I'm sure all the people in the chat did as well. So stay healthy, enjoy the great outdoors, and enjoy the spring weather. I know it's going to be up and down the next couple of days, but there's a light at the end of the tunnel here.
Thank you so much.
Thank you so much.
Okay.
Bye.